My name is Michael Ainsworth. I have a referral practice just south of Sheffield. Mainly do implants and complex restorative, and I've been using EthOss since it came out, and similar materials since 2007, almost exclusively. I originally started using bovine materials, an autogenous bone. Then I met Peter Fairburn in 2006, 2005 actually, really, and over time he persuaded me that these synthetic materials were worth using, and so over that period of time I started using a product called Vital, and had good results with it. Then really it became my exclusive product for grafting over that period of time, and so since 2007, 2008 I've been using these materials almost exclusively. So and then I was lucky to be sort of fairly early to the party with EthOss, and it's just all of those. We used to use little bits of powder, modifying it here and there and changing the properties depending on what we wanted, and it seems that EthOss just sort of fulfills the criteria that we require fully, so we can use it for most things. It just works. That's the strange thing. You obviously have to know how the material works. It's, if you're coming from a different background, it does take a little bit of time to acclimatise yourself, so there are a set of protocols that work very, very well with this particular product, from extraction through 4-week placement, grafting at the same time as placing a dental implant, which is slightly the wrong way around as far as old-fashioned grafting is concerned, and it's a suite of techniques rather than a bone grafting material, I'd say. So you can't, it's almost going from one sport to another sport. You can't use exactly the same rules for football as you do for rugby. So it's like changing disciplines, if you like. Broadly the same thing you're trying to achieve, but a different set of rules. Well, it's either really good or it's gone wrong, which is very useful. Certain other materials which don't get absorbed back in, so EthOss is basically all gone in 18 months. So it's disappeared. So if you've got a good result 18 months down the line, it's bone, it's the host bone, and so it's good. And if it's bad, that gives you the information you need to either revise or redo, and so that's useful as well. Again, with things that have got hydroxyapatite crystals in them, sometimes you don't know whether it's bad until a long time down the road, and it's a different way of analysing things, but pretty much if it's looking good after a year or so, it's just going to stay the same, and it responds very well to load as well, because again it's host bone. It's one of those materials that's not that forgiving to lack of attention to detail, shall we say. So you need to be very, very fastidious about everything about the surgery, really. Tend to try and do smaller surgeries rather than larger surgeries. For small to medium-sized defects, it's bar beat, really, and for larger defects you do need some supplemental things, but most of the time it just works very, very well within the remit of what it's for. And also don't be too greedy. With other bone grafting materials, you tend to overbuild, and then it disappears. Whereas with EthOss, you just build to where you want the bone to be and stop. And so yeah, really it's quite a simple thing to use. And so rather than getting too creative to start with, there's a very sort of direct set of protocols that you can use, and stick to those, and then, you know, almost ignore what some of us post on social media. Just follow the rules, do small defects to start with. Anything that looks either big or a bit dodgy, use your old technique until you're really, really comfortable, and then move on to EthOss. What people find is that they have this giant defect and they say, well, I'm just going to throw a bit of EthOss in. What do you think? And you think, well, maybe don't start with that one. Start with something that's a bit more of a slam dunk. It's like anything. And so what tends to happen is people have failures because they go sort of straight out of the box into something massive rather than just sort of working your way in. It's like anything. You wouldn't sort of start with a massive implant case if you'd never done them before. You just start with something little and then just gradually build. And if it fails and it's a little thing, then it's not the end of the world. But yeah, I'd say read as much as you can, and then just start small and gradually grow it from there. Start to understand how everything works, and then there are lots and lots of mentors, lots of people around the place that will happily answer questions, and maybe ask questions about the case before you do the case. Watch someone else do it, watch someone else use the material. There's plenty of resources on the EthOss website for you to watch, and yeah, just learn before you go, and start small. Well, it's got a very broad range of materials that you use it for. I think the classic solution is a single tooth that's failing, fairly decent size defect, removal of the tooth, allowing it to heal for 4 weeks, opening a flap up, placing an implant in, using an implant as the main substrate for your graft, and then placing the graft over the top, and then closing it completely, and then leaving it. And that's just so incredibly reliable, even with defects that you would traditionally be quite worried about. And it just seems to work very, very, very well. It's a bit old-fashioned these days, you know, putting gum back over the top of an implant. And doing closed two-stage surgery, but as I say, it's really, really reliable, and it's just the protocol is very, very well established. It works. Now there's a lot of people that put healing caps on and immediately load, and for example, it's the best material in my opinion for what we call the jump gap between an implant and where you take a tooth out. So a tooth is conical shape, implant's round, you put the implant in and there's a jump gap between the two, and then you just plug EthOss in there, and it works really, really well for those things. Advice to switch to EthOss: it's a very, very different way of thinking. Every other material pretty much requires big open surgery, it requires more of a staged approach, and it also requires membranes over the top of the material. EthOss doesn't require a lot of that stuff, but at the same time you can't just sort of slap it in and just go for it. It does require a slight change in your mindset, so it would really be ask as many questions as you can, maybe go on a course, and then present your case on either the Facebook group or find a mentor that's close to you, and ask questions about the case, maybe even go and watch someone use it once or twice, and then really go for it.